Did you know? Research published in the Journal of the American Heart Association reveals that nearly 80% of people who experience a heart attack for the first time had uncontrolled blood sugar levels for years, and the majority of them had no idea. 80%. That is not a small number. That is most people. Many people believe that. Heart attacks are mainly caused by eating too much fat, having high cholesterol, or simply getting older. And while those things do play a role, research now shows that elevated blood sugar, even at levels that don't yet qualify as full diabetes, can silently damage your heart and blood vessels for years before any warning signs ever appear. The connection between blood sugar and your heart is one of the most underappreciated stories. In modern health, most people walk around managing one without realizing it is deeply affecting the other. We often think that as long as we don't feel sick, things are probably fine. We go about our days, eat our meals, take an afternoon rest, and assume that our bodies are ticking along just as they should. But here's the thing: blood sugar doesn't send you a clear signal when it starts creeping up. It doesn't cause sharp pain. It doesn't announce itself. It works quietly in the background, gradually making changes to the inside of your blood vessels and your heart that can take years to become visible on the outside. And by the time most people learn about this connection, they often wish someone had told them sooner. That's why we're here today. Welcome to Senior Wellness with Livia. Today, we're going to walk through something that doesn't get nearly enough attention in everyday health conversations: the powerful and very real connection between your blood sugar levels and your heart health. We're going to look at how blood sugar affects your blood vessels, why that matters for your heart, what happens inside your body during a blood sugar spike, and what kinds of everyday habits can either protect your heart or slowly put it at greater risk. We'll keep everything clear and simple. No complicated medical language, no overwhelming statistics, just honest, research-based information that you can understand, reflect on, and use. By the end of this video, you'll have a much clearer picture of what blood sugar actually does inside your body, why it matters so deeply for your heart, even if you've never been told you have diabetes, and what small, steady changes can make a meaningful difference in protecting both. You'll walk away feeling informed, not frightened, empowered, not overwhelmed. Let's begin. Let's start from the beginning, because sometimes the most important things are the ones we think we already know but may not have fully understood. Blood sugar, or blood glucose, is the main source of energy for every single cell in your body. When you eat food, whether it's a bowl of oatmeal in the morning or a piece of fruit in the afternoon, your digestive system breaks that food down into glucose. That glucose enters your bloodstream, and your blood carries it to your muscles, your brain, your organs, and every other part of you that needs fuel to function. Now, to move glucose from your blood into your cells, your body uses a hormone called insulin. Think of insulin as a key and your cells as doors. When blood sugar rises after a meal, your pancreas releases insulin, the key unlocks the door, glucose enters the cells, and your blood sugar comes back down to a healthy level. That process, when it works correctly, is perfectly designed. But here's where things can begin to shift, especially as we get older. Over time, particularly when blood sugar is frequently elevated, or when there is excess weight around the midsection, or when we are less physically active than we used to be, the cells in our body can begin to stop responding to insulin as well as they once did. The key still exists, but the door becomes harder to open. The pancreas has to work harder, pumping out more and more insulin to try to get the same job done. This is called insulin resistance, and insulin resistance, even before it develops into full type 2 diabetes, has a direct effect on your heart and your blood vessels. Here's why that matters so much when blood sugar stays elevated. Either because of insulin resistance, prediabetes, or diabetes itself, it begins to have a damaging effect on the inner lining of your blood vessels. Researchers call this inner lining the endothelium. You can think of it as a very delicate, very thin coating on the inside of every artery and vein in your body. This lining, when healthy, is smooth and flexible. It helps your blood flow easily. It helps your blood vessels expand and contract naturally, and it helps prevent harmful substances from sticking to the walls. But when blood sugar is high, especially over a long period of time, that delicate lining begins to break down. It becomes inflamed. It becomes less flexible, and it becomes easier for fatty deposits and other materials to begin sticking to the walls of your arteries. That process, that slow, quiet buildup, is one of the primary ways that heart disease develops, and blood sugar is one of its most consistent and underappreciated drivers. Before we go any further, here is something genuinely encouraging that research has confirmed again and again: the human body, even in its 60s, 70s, and 80s, has a remarkable capacity to respond positively to change. Studies published in leading cardiovascular journals have shown that even modest improvements in blood sugar control, not perfection, just meaningful improvement, can lead to measurable reductions in cardiovascular risk in a relatively short period of time. The endothelium, that delicate lining we just talked about, can begin to recover its function when blood sugar is brought into a healthier range. Your body is not working against you, it is working with you, always looking for the opportunity to heal. Our job is simply to give it the right conditions to do that. Now let's go deeper into what actually happens when blood sugar spikes. Imagine your bloodstream as a river. When everything is balanced, that river flows smoothly and steadily. The water is clear, the current is calm, and everything moves the way it should. Now imagine someone pours a large amount of thick, heavy syrup into that river. Suddenly, the water becomes thicker, stickier, and harder to move through. The current slows. Things that would normally flow freely begin to get caught and stuck. That is a simplified but accurate way to understand what happens to your blood when glucose levels spike too high. When blood sugar rises sharply, which can happen after a large meal that is heavy in refined carbohydrates and sugar, or when a person is under significant stress, or when physical activity is very low, several things happen in your cardiovascular system almost immediately. First, your blood becomes, in a very real sense, thicker. Red blood cells begin to clump together more easily. The natural flow of blood through your arteries and capillaries becomes less efficient. This creates additional strain on your heart, which has to pump harder to keep blood moving to all of your organs. Second, the walls of your blood vessels experience a kind of stress response. That endothelial lining we talked about triggers inflammatory signals, essentially a quiet alarm system saying, something is not right here. And while inflammation is normally a protective response, when it becomes chronic and low-grade, happening day after day because blood sugar is frequently elevated, it becomes damaging rather than protective. Third, and this is the part that surprises most people, research shows that after a significant blood sugar spike, the body produces a surge of what are called free radicals. These are unstable molecules that damage cells, including the cells that line your arteries. Researchers refer to this as oxidative stress. And oxidative stress, over time, accelerates the aging of your blood vessels and contributes to the stiffening of the arteries, a process known as atherosclerosis. Atherosclerosis is the scientific word for the gradual buildup of plaque inside your arteries, and a heart attack occurs when a piece of that plaque breaks away, a clot forms, and blood flow to a section of the heart muscle is suddenly blocked. Here is the critical link that most people haven't been told. Elevated blood sugar doesn't just contribute to plaque formation. It also makes existing plaque more unstable, meaning more likely to rupture and cause that sudden blockage. This is why researchers have found such a strong, consistent relationship between blood sugar levels and heart attack risk, even in people who have not yet been diagnosed with diabetes. There is a stage that sits between completely normal blood sugar and type 2 diabetes. It's called prediabetes. And it is estimated that more than 1 in 3 adults in the United States has it. What makes this particularly significant is that the majority of those people, approximately 80% according to the CDC, don't know they have it. Prediabetes means your blood sugar is higher than it should be, but not yet high enough to be classified as diabetes. Many doctors and patients used to think of it as a kind of waiting room, a space where you weren't quite sick yet, but might become sick later. And because there are often no obvious symptoms, it was easy to dismiss. But here is what research has made increasingly clear. The cardiovascular damage associated with elevated blood sugar doesn't wait until a person reaches the diabetes threshold. It begins during the prediabetes stage. A major analysis published in The Lancet looked at data from hundreds of thousands of people and found that individuals with prediabetes had a significantly elevated risk of heart attack and stroke compared to those with normal blood sugar, even when their levels had never crossed into the diabetes range. Let that sink in for a moment. You don't have to have a diabetes diagnosis to be experiencing blood sugar-related strain on your heart. The damage can be happening quietly, gradually, in the prediabetes window, the very window where most people feel fine and receive little to no intervention. This is exactly why understanding this connection is so important, because the prediabetes stage is also the stage where lifestyle changes have the most powerful and lasting impact. It is truly a window of opportunity. Now, there is another piece of this story that is rarely discussed in everyday health conversations, but it is one that scientists and cardiologists consider extremely important, and it involves something called advanced glycation end products, which researchers shorten to the acronym AGES. The name might sound complicated, but the concept is actually quite simple, and in fact, there's a wonderful everyday analogy that makes it very easy to understand. Have you ever seen what happens to a piece of bread when it is left in a toaster too long? It turns brown. It becomes stiff and brittle. It loses the softness and flexibility it had before. What you're witnessing in that toaster is a chemical process in which sugar molecules bond to proteins under heat, and the result is a browned, stiffened, less functional material. Scientists call this the Maillard reaction in cooking. In the body, a very similar process occurs when blood sugar is chronically elevated. When there is excess glucose floating in your blood over a long period of time, those glucose molecules begin to attach themselves to the proteins and fats in your body. They don't need external heat to do this. The natural chemistry of an elevated blood sugar environment is enough. And when this bonding happens, it creates what we call advanced glycation end products, those AGEs. Now, AGEs are a normal part of aging to some extent. They accumulate in everyone's body over time. But when blood sugar is chronically elevated, they accumulate much faster and in much larger quantities. And what do they do to the cardiovascular system? They make the walls of your arteries stiffer and less elastic. Healthy arteries are somewhat like rubber bands. They can expand and contract with each heartbeat, gently adapting to the flow of blood. But arteries that are loaded with AGEs become more like stiff tubes. They lose their flexibility. This means your heart has to work harder to push blood through them. And over time, that extra workload on the heart, combined with the structural weakness caused by stiffened artery walls, significantly increases the risk of cardiovascular events. Research has also shown that AGEs trigger inflammation in the arterial walls, making those walls more permeable, essentially making it easier for harmful cholesterol particles to slip through and begin forming plaque deposits inside the artery. So the connection between blood sugar and heart disease isn't just one mechanism, it's several, all working together. Elevated blood sugar increases inflammation, promotes oxidative stress, creates arterial stiffness through AGEs, and makes the inner lining of blood vessels more vulnerable. Each of these pathways, on its own, raises cardiovascular risk. Together, they create a significant and compounding effect. Before we continue, I'd like to ask you something, and you don't need to answer out loud, just take a quiet moment to reflect. When was the last time your doctor checked your blood sugar? Not just your fasting glucose, but your HbA1c, which is a test that shows your average blood sugar level over the past 2 to 3 months. If it's been a while, or if you're not sure what your numbers are, that's okay. That's one of the most important takeaways from today. Knowing your numbers gives you the power to take action early, when it matters most. We'd love to know, has your doctor ever talked to you about the connection between your blood sugar and your heart health? Drop a note in the comments. Your experience might be exactly what someone else needs to hear. Now let's talk about the numbers, because understanding what to look for gives you real power in your health journey. There are 2 key blood tests that give you the clearest picture of your blood sugar status. The first is the fasting blood glucose test. This measures the level of sugar in your blood after you've gone without eating for at least 8 hours, typically done first thing in the morning. A fasting blood sugar level below 100 milligrams per deciliter is considered normal. Between 100 and 125 falls into the prediabetes range, and 126 or above on 2 separate occasions is the threshold for a diabetes diagnosis. The second test, and this is the one that many doctors now consider even more informative, is the HbA1c, also called the hemoglobin A1c test. Rather than giving you a single point-in-time measurement, this test looks at how much glucose has been attaching to your red blood cells over the past 2 to 3 months. It's like getting a moving average rather than a single snapshot. An HbA1c below 5.7% is considered normal. Between 5.7% and 6.4% indicates prediabetes, and 6.5% or higher on 2 occasions indicates diabetes. Here is why the HbA1c is so valuable for understanding your heart risk. Because it captures patterns of blood sugar exposure over time, it gives a much clearer picture of how much glycation, that process of sugar attaching to proteins, has been occurring in your blood vessels. Multiple large-scale studies, including the landmark UCT's trial, found that for every 1% reduction in HbA1c, the risk of heart attack and stroke dropped significantly. That is a powerful, research-verified relationship. And it means that small, sustainable improvements in blood sugar control can translate directly into meaningful protection for your heart. Now, beyond these 2 tests, there is one more measurement worth knowing about, and it's one that your doctor can check as part of a standard blood panel. It's called fasting insulin, while blood glucose tells you where your sugar levels currently stand. Fasting insulin gives you insight into how hard your pancreas is working to keep those levels in check. A high fasting insulin level, even with a normal blood sugar reading, can be an early signal that insulin resistance is developing. And as we discussed earlier, insulin resistance is one of the key drivers of the blood sugar-heart connection. Knowing these 3 numbers, your fasting glucose, your HbA1c, and your fasting insulin, gives you and your doctor a much more complete picture of where you stand and what steps would be most helpful for you personally. This is perhaps the most encouraging part of today's conversation because this is where science becomes genuinely hopeful. The Diabetes Prevention Program, one of the most important clinical trials in modern health history, enrolled thousands of adults across the United States who had been identified as having prediabetes and elevated cardiovascular risk. The participants were divided into groups. One group received standard medical care, one group received a medication commonly used for blood sugar management, and one group participated in a structured lifestyle program focused on modest but consistent changes in eating and physical activity. The results were remarkable. The lifestyle intervention group, through nothing more than sustainable, realistic changes to daily habits, reduced their risk of developing full type 2 diabetes by 58%, and the average age of the participants was not young. These were men and women in midlife and beyond. And importantly, the benefits to cardiovascular markers, including blood pressure, inflammatory signals, and arterial health, were measurable and significant even in the early months of the program. You don't need to run marathons. You don't need to follow a complicated diet. What the research shows consistently is that small, consistent, sustainable changes, when made with intention and maintained over time, have a profound effect on blood sugar, heart health, and overall quality of life. Let's walk through what those changes look like in real, everyday terms. One of the most powerful tools available to you, and one that requires no prescription and no special equipment, is movement after meals. Research published in Diabetes Care found that taking a gentle 10 to 15-minute walk after eating, particularly after dinner, significantly reduced the post-meal blood sugar spike compared to sitting still. The muscle activity during even a slow, easy walk activates the muscles in your legs to absorb glucose directly, without needing insulin to unlock the door. This is sometimes described as a kind of metabolic bypass, and it works remarkably well. You don't need to walk fast. You don't need to cover any particular distance. A calm, steady stroll around the block or even around the house after meals done consistently can meaningfully flatten those blood sugar peaks that stress the cardiovascular system. The second habit that research strongly supports is what many scientists now call fiber first. When we eat, the order in which we consume different types of food affects how quickly glucose enters our bloodstream. Studies from Weill Cornell Medicine found that when people ate fiber-rich vegetables and protein before eating starches and sugars in the same meal, their post-meal blood sugar spike was substantially lower than when they ate in the traditional order of starches first. A practical example: if you're sitting down to a meal that includes some bread, chicken, and a salad or cooked vegetables, try eating the vegetables and protein first and saving the bread for later in the meal. It sounds almost too simple to make a real difference, but the research shows it does. A third area that deserves attention is sleep. This surprises many people, but the science is well established. Poor sleep, whether it means fewer hours of sleep or disrupted, low-quality sleep, directly impairs insulin sensitivity the next day. A single night of poor sleep has been shown in research studies to produce a measurable increase in blood sugar levels the following morning. Chronic sleep disruption is now recognized as an independent risk factor for both insulin resistance and cardiovascular disease. If sleep is difficult for you, whether it's falling asleep, staying asleep, or waking too early, it's worth bringing up with your doctor as part of your overall heart and blood sugar health conversation. It is genuinely connected. And finally, stress. Not because we want to add another thing to worry about, but because understanding the mechanism is empowering rather than alarming. When we experience stress, whether physical, emotional, or situational, the body releases hormones like cortisol and adrenaline. These hormones signal the liver to release stored glucose into the bloodstream. It's the body's ancient fuel-up for action response, designed for moments of physical danger. But in everyday modern life, when stress is emotional and prolonged rather than physical and brief, this glucose release happens without being burned off through movement. The result is chronically elevated blood sugar, driven not by what we eat but by how we feel. Gentle stress reduction practices, whether that's a few minutes of quiet breathing each morning, a brief period of sitting outside in natural light, prayer or meditation, or even simply connecting with someone you care about, have been shown in research to lower cortisol levels and improve blood sugar regulation over time. These are not alternative medicine claims. These are findings published in peer-reviewed journals, and they reinforce something important. Taking care of your emotional and mental well-being is not separate from taking care of your heart and blood sugar. It is the same thing. There's one more piece of this puzzle that ties everything together, and it's something researchers have been increasingly focused on over the past 2 decades. It's the role of inflammation as the bridge between blood sugar and heart disease. For a long time, cardiovascular medicine focused heavily on cholesterol as the primary driver of heart disease, particularly LDL cholesterol. the kind often described as bad cholesterol, and cholesterol does play an important role, but researchers began to notice something puzzling. Some people with low cholesterol were still having heart attacks, and some people with high cholesterol were living long lives with healthy hearts. Something wasn't adding up. The missing piece, in large part, turned out to be inflammation. In the late 1990s and early 2000s, groundbreaking research by Dr. Paul Ridker at Harvard Medical School demonstrated that a marker of inflammation called C-reactive protein or CRP was a powerful predictor of heart attack risk, sometimes more powerful than cholesterol alone, and elevated blood sugar, as it turns out, is one of the most consistent drivers of elevated CRP. Here is how to think about it. Plaque doesn't build up inside arteries simply because cholesterol is present. It builds up and becomes dangerous because the inflammatory environment inside the artery wall draws cholesterol in, causes it to become trapped and oxidized, and then triggers an immune response that accelerates the damage. Elevated blood sugar creates and sustains exactly that inflammatory environment. This is why researchers now refer to blood sugar and cardiovascular disease as deeply intertwined, not two separate health concerns, but two expressions of the same underlying process happening in your blood vessels. The good news that flows from this understanding is equally important. Reducing chronic inflammation through improved blood sugar management, better sleep, stress reduction, an eating pattern rich in anti-inflammatory foods, and consistent gentle movement addresses cardiovascular risk from multiple directions at once. It's not about fixing one number on a lab report. It's about changing the internal environment of your body so that it functions more like it was designed to, and people do this every single day. In their 60s, 70s, and 80s, with patience, consistency, and support, we want to be clear that this is an educational conversation, not medical advice, but because we care about giving you complete and honest information, it's worth mentioning that in recent years, certain medications used for blood sugar management have also been found to have direct, measurable benefits for the heart independent of their blood sugar effects. Several large clinical trials have found that a class of medications called SGLT2 inhibitors, which work by helping the kidneys remove excess glucose from the body, also reduced hospitalizations for heart failure and cardiovascular events in people with diabetes. Similarly, another class called GLP-1 receptor agonists, which you may have heard of under brand names that have been in the news recently, have shown meaningful reductions in heart attack and stroke risk in research studies. These medications are not appropriate for everyone, and this is absolutely a conversation to have with your personal physician. But the point we want to make is this: the medical community now considers blood sugar management and cardiovascular management to be inseparable. If you have diabetes or prediabetes and you are managing it with your doctor, ask specifically about what that means for your heart health. Ask about your cardiovascular risk. Ask about your inflammation markers. Ask to see the whole picture. And if you haven't had a full blood sugar panel recently, fasting glucose, HbA1c, and fasting insulin, consider requesting one at your next visit. It is information your heart deserves you to have. Now, while elevated blood sugar is often described as silent, there are subtle signs that some people notice, particularly when blood sugar has been elevated for an extended period of time. These are not signs to fear, but signs to be aware of, because noticing them is the first step toward addressing them. Persistent fatigue that doesn't improve with rest is one. Not the normal tiredness that comes from a busy day, but a deep, unexplained tiredness that lingers. This happens in part because when cells can't access glucose efficiently, they are essentially running low on fuel even when glucose is circulating in the blood. Another sign is increased thirst and more frequent urination. When blood sugar is elevated, the kidneys work harder to filter the excess glucose out of the blood, which draws more water with it. This can leave a person feeling thirsty more often than usual and needing to use the bathroom more frequently, particularly at night. Some people also notice that small cuts or skin irritations seem to heal more slowly than they used to. Elevated blood sugar affects the ability of the immune system and circulation to deliver healing resources to the skin efficiently. And slow wound healing is a recognized sign that blood sugar regulation may be struggling. Frequent infections, particularly urinary tract infections or skin infections, can also be a signal, because elevated glucose provides an environment that certain bacteria and fungi find particularly favorable. And finally, some people notice tingling, numbness, or a faint burning sensation in their feet or hands. This can be an early sign of peripheral neuropathy, changes in nerve function related to elevated blood sugar over time. None of these signs alone is diagnostic of any particular condition. But if several of them feel familiar, it is genuinely worth bringing them up with your doctor. Your body is often speaking to you long before a test result confirms what's happening. Learning to listen calmly and attentively is one of the most important health skills you can develop. Now, we'd love to hear from you. Has anyone in your life, a doctor, a family member, or even a friend, ever connected your blood sugar levels to your heart health? Was it something you already knew about, or is this new information for you? Please share your experience in the comments below. Your story might be exactly what someone else in this community needs to hear today. And if this video gave you something to think about, consider sharing it with someone you care about, because this is the kind of information that genuinely deserves more conversations. Everything shared in this video is for educational purposes only and is based on published research. Please always speak with your personal physician before making any changes to your health routine, your diet, your activity level, or your medications. Your doctor knows your individual health history and is the right person to guide you through what these ideas mean specifically for you. In our next video, we're going to explore something that quietly affects millions of people over 60 and that many don't realize is connected to both their blood sugar and their blood pressure. It's happening during a specific time of day that most of us take for granted. You won't want to miss it. Thank you for spending this time with us today. Taking the time to understand your health calmly, clearly, and without fear is one of the most caring things you can do for yourself and for the people who love you. Your body has carried you through an entire lifetime. It is resilient, it is responsive, and it is always ready to work with you when you give it the right support. Stay curious, stay empowered, and take gentle, steady steps toward the health you deserve. We'll see you in the next one.